Hi, and good morning. My name is Mary Herbert, and today I'll be presenting you guys with a discussion about care coordination and all of the factors that are needed to provide care coordination. First, I'll begin with what care coordination is and the importance of well-rounded continuum of care. I will explain the importance to the specific healthcare issue of mental health. Care coordination can be described as synchronized care directed for a patient and their family that is needed to be communicated between healthcare team members. Definition exemplifies the importance of well-rounded care. I want to now discuss further how mental health patients need coordination of care to receive the adequate care they deserve. Providing well-rounded, adequate care to patients is what healthcare workers are guided to do. Included in this is mental health care. Although not necessarily always physical, mental health is a very important piece of healthcare. This assessment will propose how change management can improve mental health in healthcare. Change management can be described as planning, implementation, and solidification of changes within a process or organization. I will explain changes needed for this topic of mental health that will exemplify how impactful changes and proper coordination of care can be on their patient and their families. This assessment will also discuss the needs of mental health as well as include physical, psychosocial, cultural considerations around mental health. Mental health is commonly overlooked in healthcare. Considering people's mental health is vital to providing adequate care and safe care. Identifying risk factors upon admission or in an outpatient setting need to be part of the care provided. An article about mental health risk factors states, quote, the prevalence of mental health disorders is very high. In the United States, in 2016, an estimated 18.3% of all adults experience mental health illness. Within the prevalence of high among young adults aged 18 to 25 years. That's Kumut-Zalago, 2019. This quote exemplifies how vast the importance of recognition of all types of mental health diagnoses is. Mental health has a wide variety of understandings with the use of this blanket term. Mental health conditions can be minor everyday things people are struggling with, as well as many more serious diagnoses needing medical intervention. Ignoring mental health leads to many detrimental things, especially suicide. Best practices around improving mental health care need to be focused on recognition and diagnosis. I'll now move into some goals and resources. Although healthcare deals with so many disparities, improving mental health should be taken forefront. This can be started by including 3 goals. The 3 goals would be to identify risk factors, begin mental health assessment on admission, and ensuring inclusion as well as follow-ups. The first goal is identifying risk factors. Mental health conditions have many leading factors. Identifying these can help decrease the number of silent sufferers. Risk factors include modifiable and non-modifiable. In an article about mental health risk factors, the author states, quote, urban environment exposures are an important category of potential risk factors for mental health disorders that have been generally overlooked and only recently started attracting attention. Although genetic, lifestyle, and social factors do play an important role in developmental of mental health disorders, built and natural environments are equally important part of our lives that need to be recognized as a critical component of overall health. Identifying these urban environmental exposures that ameliorate or worsen when mental health can inform regulatory action, development of targeted interventions, and a redesign of our neighborhoods, communities, and cities with the goal of prevention of mental health disorders and promotion of well-being through urban planning. End quote. Kumut-Zalago, 2019. This quote embodies the goal of identifying mental health risk factors early in order to provide better care. The second goal is to begin a mental health assessment on admission or at the start of care. A study was done in an English hospital on the creation of an admission tool that assists in the initial mental health assessment as well as plans after discharge. This tool, once finished, was composed of a 10-step assessment. The study proved to be helpful in the insight of a patient's mental health status. The author states, quote, reported advantage of the tool were 1, facilitating confidence in junior staff to legitimately ask questions to suitability of the patient of the acute ward. 2, collecting and storing essential information in a single accessible place that can be used throughout the pathway. And 3, collecting information from services agencies to which patients will eventually get discharged. End quote. Tyler et al. 2021. The third and final goal is to ensure inclusion in care and follow-ups are being completed. Inclusion in care is to allow patients, will allow comfort in any issues they can confront and will have, inclusion of care will allow patients to confront any issues they may have and allow healthcare team members to help them. This is a hard thing to do for many patients due to the feeling of vulnerability. Follow-up appointments after this breakthrough with this patient are vital. Having someone call and check in to ensure the care plan devised in the office is still applicable to them at home. A study was done in an article about follow-ups after medication prescriptions were given to mental health patients. In this study, a nurse would follow up with the patient to ensure the medication was working, there were no issues remembering to take the medication, and there were no extreme adverse reactions to the medication. The article concluded with adequate results and states, quote, many ADRs and ADEs are preventable, and there can be significant resource and cost implication for health systems in failing to tackle a problem, end quote. Jordan et al. 2019. Providing resources for patients to use and reach out to in the time of need is vital. During the pandemic and the post-pandemic time, there are many people suffering silently with mental health issues. Having online resources that can be accessed from the comfort of the patient's own home is a great resource. Although many people agree that in-person visits can be more effective, online resources provide initial comfortability. At MUSC in Charleston, South Carolina, the hospital offers e-mental health appointments to their patients as well as their staff. The university allows patients to book with whichever provider they believe would be the best fit for them. Creating relationships through e-appointments can prove to be difficult over the phone, yet with the inclusion of Teams or any video application, this relationship can be strengthened. An author who studied online interactions during mental health appointments post-pandemic states, the therapeutic relationship in community health has been defined as an appraisal of connection and interaction between service users and clinicians that is defined through the delivery of mental health treatment. Qualities including trust, hope, empathy, and encouragement are argued to be at least as important as a therapeutic technique in mental health, end quote. Williams et al. 2021. Although the MUSC e-network is only one community resource, I consider the second resource being the relationship built through the initial resource. I'll now move into ethical dilemmas. Ethical dilemmas are sometimes a touchy subject for healthcare workers. As providers to people in need, we are called to always do what is best for our patients. Sometimes we run into ethical dilemmas with differing opinions. The Nursing Code of Ethics can help us uphold these standards. The Nursing Code of Ethics was developed to guide nurses on responsibilities and manners consistent with providing quality nursing care and difficult ethical responsibilities that lie within the profession. As previously stated, mental health can have many effects on patients as well as their families. Many patients struggle with mental health issues alone. With mental health issues, exterior and physical symptoms are not always present. This is why diagnosing and providing care around mental health proves to be difficult. An article by O'Brien discusses his views on mental health when he states, quote, media depictions of mental health difficulties and suicide are an important element in shaping how the public understands the issues and how relevant agencies devise strategies to advocate and reduce stigma for people with mental illness, end quote, 2021. This quote discusses how the outside view and stigmas related to mental health make it hard for people to express any mental health concerns they may have out of fear of embarrassment. The next question to discuss is ethical dilemma topic about social determinants. Healthy People 2030 speaks about 4 main social determinants in healthcare. These are poverty, unequal access to healthcare, lack of education, and stigma/racism. These can most definitely affect care coordination, but the culturally competent healthcare provider, these issues should be addressed directly, and the policies, acts, and codes spoken about previously should be upheld. Healthy People 2030 creates a goal of, quote, attain healthy, thriving lives, well-being free of preventable disease, disability, injury, and premature death. Eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. Create social, physical, and economic environments that promote attaining the full potential for health and well-being. Promote healthy development, healthy behaviors well across all life stages. Engage leadership, key constitutes, and public across multiple sectors, and take action and design policies that can improve health and well-being of all. End quote, Office of Disease 2020. This initiative is groundbreaking in improvements of coordination of care and many different health disparities. To discuss cultural factors about mental health, some cultures look down on mental health issues and limit family inclusion with certain diagnoses. For example, an article states, quote, Hispanic/Latinos utilize mental health care at a rate that is about half of non-Hispanic whites. Stigma and cultural and religious values play a significant role in mental health utilization disparities. End quote, Capella 2019. With Hispanics/Latinos being the largest minority in the United States, this needs to be a major area of focus within the improvement of healthcare mental health recognition. The last topic I'll go into is policies and priorities. The two most prevalent policies or acts that are essential in giving adequate, safe care to mental health patients are HIPAA and the ACA. The reason HIPAA is vital is because of the patient's comfort in the knowledge that their health information is protected. Knowing that their health information is protected is a huge aspect in allowing mental health patients to come forward with their issues rather than suffering silently. HIPAA stands for Health Insurance Portability and Accountability Act. This act was implemented in 1998 in an effort to protect the patient's privacy. The CDC explains HIPAA as, quote, a federal law that required the creation of national standard to protect sensitive patient health information from being disclosed without the patient's consent or knowledge, 2022. As healthcare workers, we are all called to uphold privacy of our patients. Information protected by HIPAA that we use on a daily basis includes name, address, any dates that are directly related to an individual, including birthday, date of admission, date of death, or the exact age of individuals older than 8, telephone number, email address, social security number, and medical record number, Walker 2022. Care coordination is affected by HIPAA specifically in two ways. The two ways I want to highlight how the community is affected by by communication and empowerment. HIPAA affects coordination of care through communication. HIPAA allows for improvements in communication between providers as well as patient-provider relationships. HIPAA allows for safe sharing of patient information, therefore improving care coordination. The second way HIPAA affects care coordination is through patient empowerment. HIPAA allows patients to be interactive in their care and have easy access to their healthcare information. The second policy that remains a priority in the well-rounded care of mental health patients is the ACA. The ACA was enacted in 2010 with 3 goals in mind. The first goal is to make affordable health insurance available to more people. The second goal is to expand the Medicaid program. And the third goal is to, quote, support innovative medical care delivery methods designed to lower the cost of healthcare generally, quote, end quote, U.S. Centers 2022. The ACA improved care coordination through ways such as quality improvement and payment reform, while also having close monitoring considerations of specific patient populations. The ACA has a major impact on mental health patients and the community. An article about the direct effects states, quote, there were more than 48 million uninsured people when the ACA was passed. People with mental illness are more likely to have low incomes and to be uninsured. The ACA addressed these problems by pairing coverage expansions with access to mental health care. Efforts to expand coverage, including allowing young people to stay on their parents' plans until the age of 26 and expanding the Medicaid program, led to a drop in the number of uninsured to 30.4 million by 2018. Bog-Gartner et al. 2020. Overall, the care coordination within the mental health patient population is influenced by many factors. With the help of this plan and an interdisciplinary team implementing the proposed goals and changes, the patient community will be better served overall.